Have you ever heard about malignant hyperthermia? It's not a common dinner table topic, but it's a crucial piece of knowledge for those in the medical field and anyone undergoing general anesthesia. Malignant hyperthermia, often abbreviated as MH, is an inherited disorder lurking in the shadows of our genetic code. It's often silent, exhibiting no signs or symptoms until it's triggered. And what might that trigger be, you ask? Typically, certain medications used during general anesthesia are the culprits. Imagine a sleeping giant, peacefully undisturbed until these substances enter the body, prompting it to awaken with a fury. This reaction can lead to a severe increase in muscle metabolism, which in turn can cause a dangerous increase in body temperature. It's a medical emergency that requires immediate attention. Now that we know what malignant hyperthermia is, let's delve into its signs and symptoms. What are the signs and symptoms of malignant hyperthermia? That's a question that's on many minds, especially those who have a family history of this condition. The signs and symptoms can vary, but there are some common threads that medical professionals look for. One of the first signs of malignant hyperthermia, or MH, is a dramatic rise in body temperature. This isn't a slight fever we're talking about here. No, it's a sudden and potentially life-threatening increase in body temperature that can climb as high as 108 degrees Fahrenheit or more. It's like your body's internal thermostat goes haywire, and this is a key indicator of MH. Another common symptom is muscle rigidity, particularly in the jaw. This is often one of the first physical signs, and it's known in medical circles as masseter muscle rigidity. If a person's jaw muscle becomes hard and stiff, it's a red flag that suggests the onset of MH. A rapid heartbeat is another sign. This isn't just a case of the jitters or butterflies in the stomach. It's a heart racing like a marathon runner, but without the marathon. This tachycardia, as it's known, can come on without warning, and is another major warning sign of MH. Then there's the issue of muscle breakdown. If a person with MH exerts themselves, their muscles can begin to break down, releasing a protein called myoglobin into their blood. This can lead to dark, cola-colored urine, and is a sign that the kidneys are being affected. Finally, there's a rise in carbon dioxide production, even if the person isn't doing anything particularly strenuous. This could lead to difficulty breathing, confusion, and even a feeling of impending doom. These signs and symptoms can come on rapidly and without warning. They can be frightening, both for the person experiencing them and for those around them. But knowledge is power, and understanding these signs and symptoms can be the first step towards getting the help needed. Identifying these signs and symptoms can help in early detection, but what increases the risk of malignant hyperthermia? As we'll see in the next segment, there are several risk factors to be aware of. What makes someone more likely to develop malignant hyperthermia? This is the question we're exploring in this segment. There are several risk factors that can increase the likelihood of someone developing this condition. Firstly, family history can play a significant role. If a relative has had an episode of malignant hyperthermia, you may be at a higher risk. Secondly, certain muscular and neuromuscular disorders can predispose individuals to this condition. These include conditions like Duchenne muscular dystrophy and central core disease. Lastly, exposure to specific anesthetic agents is a major risk factor. Volatile anesthetic gases like isoflurane, desflurane, and sevoflurane, as well as the muscle relaxant succinylcholine, can trigger an episode of malignant hyperthermia. Understanding these risk factors is crucial. It's about knowing what could potentially set off a dangerous chain reaction in the body. This knowledge allows for preventive measures, reducing the likelihood of an episode occurring. Understanding these risk factors can help prevent its occurrence, but if it does occur, how do we treat it? How is malignant hyperthermia treated? Well, tackling this condition is a twofold process: immediate treatment and supportive care. The cornerstone of treating malignant hyperthermia is to stop the triggering agent immediately. If a patient is undergoing surgery and starts exhibiting signs of malignant hyperthermia, the anesthetic that's suspected to have caused the reaction is promptly discontinued. This is a critical move because it halts the progression of the condition. But halting the triggering agent isn't enough on its own. To counteract the effects of malignant hyperthermia, a medication called dantrolene is administered. Dantrolene works by relaxing the muscles and reducing the high fever associated with malignant hyperthermia. It's a potent medication specifically designed for this purpose, and can truly be a lifesaver. Now, while discontinuing the triggering agents and administering dantrolene form the primary treatment approach, they aren't the only strategies. To help stabilize the patient, supportive treatments are also employed. One of these is cooling techniques. Malignant hyperthermia can cause dangerously high body temperatures, so cooling the patient becomes essential. This is done through methods such as applying cool, damp cloths to the skin, using cooling blankets, or even administering chilled intravenous fluids. Another aspect of supportive treatment is managing metabolic abnormalities. Malignant hyperthermia can cause a slew of issues like high potassium levels, acidosis, and issues with the heart. To counter these, doctors might administer medications, adjust the patient's fluid intake, or use other methods to help normalize the body's metabolism. In sum, treating malignant hyperthermia is a comprehensive process that involves immediate action to stop the triggering agent, administering specific medications like dantrolene, cooling the patient, and managing any metabolic abnormalities. Remember, every second counts when dealing with this condition, and swift, efficient treatment can make all the difference. Treatment is crucial, but so is the care that follows. Let's explore nursing care for patients with malignant hyperthermia. What special care do patients with malignant hyperthermia need? This is a question that underlines the importance of nursing in managing this condition. Firstly, vigilant monitoring of vital signs is paramount. Malignant hyperthermia can cause a rapid rise in body temperature and heart rate, alongside other symptoms. Keeping a close eye on these signs can help in the early detection of a crisis, allowing for immediate intervention. Maintaining a patent airway is another critical aspect of nursing care. The patient's respiratory function may be compromised due to muscle rigidity or a rapid increase in metabolic rate. Nurses must ensure that the airway remains clear and unobstructed, facilitating adequate oxygen supply and preventing respiratory distress. In addition, providing supportive care is essential. This includes ensuring the patient stays hydrated, managing pain, and offering emotional support. It's important to remember that a diagnosis of malignant hyperthermia can be distressing for the patient and their family. Offering reassurance, answering questions, and providing comfort can go a long way in improving the patient's overall well-being. Education is another key aspect of nursing care. Patients and their families must understand the nature of malignant hyperthermia, what triggers it, and how to avoid these triggers. They should be aware of the early signs of a crisis and know when to seek medical help. Educating patients and their families empowers them, making them active participants in the management of the condition. Finally, nurses play a crucial role in coordinating care. They work closely with other healthcare professionals, ensuring that the patient's needs are met and that all treatments align with the overall plan of care. In conclusion, nursing care for patients with malignant hyperthermia involves vigilant monitoring, maintaining a patent airway, providing supportive care, educating patients and their families, and coordinating care with other healthcare professionals. Each of these elements is vital in managing this condition and improving the patient's quality of life. Nursing care is crucial for recovery and management, but what complications can arise from malignant hyperthermia? What complications can malignant hyperthermia cause? This is a question that's important to understand, as the complications can be severe and life-threatening. One of the most serious complications is cardiac arrest. The high body temperature triggered by malignant hyperthermia increases heart rate, putting immense strain on the heart. This can lead to an irregular heartbeat, heart damage, or even sudden cardiac arrest. Malignant hyperthermia can also lead to organ failure. The intense heat can damage tissues in the body, including vital organs like the kidneys and liver. In severe cases, these organs may stop functioning altogether. The most grave complication is, of course, death. If not treated promptly, malignant hyperthermia can be fatal. This underlines the importance of early detection and prompt treatment. Remember, health professionals are well equipped to manage malignant hyperthermia, but the key is quick recognition and action. Complications can be severe, making patient education crucial. The more we know, the better we can act to prevent these complications. How can patients protect themselves from malignant hyperthermia? Well, the most effective guard is knowledge. Knowing one's family history is crucial. If there's a relative who experienced adverse reactions to anesthesia or a diagnosed case of malignant hyperthermia in the family, this information could be a critical piece of the puzzle. In such cases, it's vital to inform healthcare providers about this history. This allows them to take necessary precautions during surgeries or other procedures involving anesthesia. But what if there's an emergency and you're unable to communicate this crucial information? This is where a medical alert bracelet becomes a lifesaver. Wearing one that clearly states your risk of malignant hyperthermia ensures that, in a crisis, medical personnel are aware of your condition and can act accordingly. Remember, malignant hyperthermia is a serious, life-threatening condition, but with the right knowledge and precautionary measures, the risks can be significantly reduced. Knowledge is power, and in this case, it could be life-saving.